viewers and listeners, today we are talking with Dr. Robert Cucin about plastic surgery. Dr. Cucin is a board-certified plastic surgeon, medical researcher, entrepreneur, founder and CEO of the Biosculpture Technology Inc. His personal goals are to guide and participate in the success of companies embarking upon worthy and promising projects for society and profit, concentrating on the medical and healthcare sectors to make a favorable impact in these sectors, beyond what he does with his own two hands as a plastic surgeon, on a patient-by-patient basis. The link on the Biosculpture Technology Inc. website will be below the video in the description section. And now my conversation with Dr. Robert Cucin. Hello, Dr. Cucin. Welcome to my show.
Hi, Alex. Thanks for having me back.
Dr. Cucin, so what are the latest developments in plastic surgery?
Well, a couple of the companies have introduced some HLA fillers that have some elasticity in them, which at least in theory will allow them to respond a little bit better to facial animation. You've got the RHA collection that Revance has, and you've got some of Galderma's Restylane products, Refine, Define, and Kiss. And if you've been around long enough, you tend to see things recycling. So these are not really new, but these are things that are coming more popular. As people are using volumizers in the face to replace the fat that's lost with age, people have tried it once with the temporary ones, and now they want to go with a more long-acting thing. And we have Artifil, which is now been remarketed as Belafil, Radiesse, and Sculptor, three products that have been around for quite a long time, but now are coming into some more uses in the cosmetic aspect as opposed to just the more reconstructive aspects that they had been used before. And we have the threads, which have become much more popular, the dissolving threads, which can give temporary effects without a whole lot of downtime.
Mm-hmm. Great. Dr. Cucin, what are the most popular plastic surgeries nowadays?
Breast augmentation and liposuction have alternated through the years as which is the most popular. But they have been up there for the last 20 years. The Brazilian butt lift is extremely popular right now, and the combo procedures, the mommy makeover, which includes the breast and the tummy tuck, extremely popular today.
How often do people want to completely change how their faces look like?
Remarkably seldom. The only people who really want to change the way they look dramatically, other than a criminal, and I don't see any of those, is basically your transgender patients who basically want to, soften the appearance from male to female or vice versa. Those are the only people who want to go dramatic.
Okay, great. And who are more drastically want to change face, women or men?
I don't think either one very much. I mean, because good surgery isn't drastic. It should be youthfulizing. It should be harmonizing, not really disruptive to the appearance, not really jarring to how the patient looked before. Unless you're correcting a defect. A microsomia by half of the face not matching the other face, like a hemifacial atrophy or a cleft lip or a cleft palate. Those are patients who want drama, who need drama. But most people just want to be, smoothing out and evening, a youthfulizing. And that shouldn't be jarring. It shouldn't be particularly dramatic. Though if you wait too long to have it done the first time, yes, it might be fairly significant.
Dr. Cucin, tell me please about chin, cheek, and jaw reshaping by using face implants or soft tissue augmentation?
Sure. In terms of cheek implants, it's very easy to just slip an implant in right through the patient's mouth, right onto the cheekbone. It can be small or large, and you make the cheekbones, the malar eminence, much more prominent. You can do the same with a chin implant, right through the mouth here, right to the chin. If you want, you can also widen the jaw a little bit by making it a little bit wider. And you can widen the jaw with soft implants or even hard implants. I prefer soft implants here because you have the nerves and you don't want to damage them. You can also change an oriental or a round face into a more angular face by sucking out some of the fat in the cheeks, and improve the cervical mandibular angle, the side view of the patient's profile, by sucking out what fat there is underneath the chin. You don't want to suck out too much fat from people's cheeks, because as we get older we lose that, and that's part of the effect of aging. But if somebody has a really round face, you can be fairly discreet as you do it, take out maybe 5 or 10 cc's, no more than that, and you can make the cheekbones more prominent.
Dr. Cucin, my acquaintances, women, want to ask you about lips augmentation. Could you tell us, please?
Sure. Well, lips thin out with age, but of course certain people are just born with fuller lips than others. We can, the plastic surgeon can be the equalizer. We can do it temporarily, but with the HLA fillers, which is my preference. And you can titrate exactly the way the patient likes it. And you have the new ones that are a little bit more elastic, that move a little bit more normally. If I were to choose my favorite, it's actually to do a kiloplasty and use fat. So you basically move some of the patient's tissues along from the inside to the outside of the mouth to increase the amount of vermilion. And you can take some fat from, say, the submental area and fill it out a little bit, and half of that stays permanently. And that's a very natural effect. You can also be much more dramatic by using an acellular matrix as a scaffold, and alloderm, for example, put that in as an implant, and that will stay as a permanent effect, and you can be much more dramatic than with that. That tends to be a little bit more noticeable if you kiss the patient.
Dr. Cucin, tell me please about the benefits of golden threads surgery.
Basically, as close as you can come for something for nothing. If you want to have a dramatic effect to youthfulize somebody, you're going to do at least a cheek lift. You're basically going to resuspend the tissue of the cheek to essentially eliminate the folds that you get around the corner of the mouth and over the edge of the jaw. You can do that with a couple of threads, as if you were just kind of lifting a curtain. You cannot be as dramatic. You're not going to get as permanent as a result. But you can get a nice delicate improvement. You can buy a patient basically, a year or two before they have a more definitive operation. It's more subtle. There's virtually no downtime. They can just go to work the next day. It's an outpatient office procedure, not a big deal. It's a more subtle effect, but it's a more gentle effect, and it's a cheaper effect, and it's a more immediate effect without the downtime.
Dr. Cucin, what new technologies do plastic surgeons use for women's breast augmentation?
Well, it's not so much that it's new, but it's basically more what's in vogue today. If you want the more youthful, fuller look at the top of the breast, the way you get that is by going underneath the muscle. That tends to keep the implant soft and avoid capsules, which is basically the body making a wall around the implant that makes it feel hard. But you get the fullness on top, which is more youthfulizing. Obviously, if woman's a swimmer or she's a mountain climber, she might not care to do that, because you do lose a little bit of the power of the pectoralis muscle that you're going underneath and have to detach a little bit. But you get the much fuller effect on top. And as we're looking at the movies and the idols on TV today, I think women have come to accept that look as normal. It's not really normal, but it's what the women are accepting as normal because that's what the patients are requesting in surgery. It gives the more full effect, you know, at the décolletage.
Mm-hmm. Dr. Cucin, for injured people in burn centers growing and transplanting skin, can plastic surgeons transplant this type of skin on the patient's face and thereby patient dispose of wrinkles?
It's actually a cool question. A book I read a long time ago that was one of the ones that actually got me interested in plastic surgery was by Robin Cook. It was called The Facemaker. And he had actually written about a World War II surgeon. He himself was an anesthetist. And he noticed that the famous surgeon who the book had been about, at the wake, all of the patients he had operated on had apparently not aged. And the reason they hadn't aged is because grafted skin, first of all, if it's not from the face, it's going to be thicker. It's not going to wrinkle and sag as much. And second of all, if you're moving tissue around, even if you're doing a full face transplant, it's going to have some degree of scarring, and it's not going to be as expressive, so it will not sag as much, will not age as quickly. But that's not really, it's kind of, I guess it's kind of the golden lining that if you're doing a face reconstruction for cancer or something like that, that patient may not show the aging through the time as much. I guess you have to get a little bit good for the bad that you lose.
Mm-hmm. I know that Asians, I know that among Asians, very popular plastic surgery which calls Westernization. What exactly Asian people want to do that to look like Western people?
I think we all want to look like each other these days. And in terms of the Asian eye, you basically have, they want the double eye. You want the supratarsal fold. The epicanthal fold, it's best to leave alone. But it's very easy to make a second fold that basically the Asian eye appears to open up a little bit, not look as sleepy, and looks westernized. And that's mainly what they're talking about. You can also talk about what we spoke about a little bit earlier, to make the face less round by a little bit of sculpting underneath the cheek implants to get a little bit more hollow in here to accent the cheekbones as opposed to just a round face. And the same here, a little bit of liposuction in the submental area to make the face look less round. That's generally the eyes being the most prevalent.
Mm-hmm. Skin lightening like had Michael Jackson is in the arsenal of plastic surgeons.
Well, actually, his problem didn't arose from vitiligo. He basically had a skin problem where his skin turned white, and that's why he began with the white glove. But the bottom line on it is we really can't do very much to lighten the skin. If there are dark spots, we can use certain bleaching screens. We cannot turn a dark person white. His major problem was vitiligo, and there's really no way of doing significant lightening. We can do peels and things like that, which can eliminate some of the women who are pregnant sometimes get some darkening around the lips and parts of the face. We can affect that, but we can't do major pigmentary changes. So that was really kind of like a misnomer or a misconception that was spread by the supermarket journals.
Dr. Cucin, do plastic surgeons use stem cells for aesthetic surgery?
Yes, fat is a 50 times better source of stem cells than bone marrow, and it's a whole lot less painful to take. And we use fat all the time. We use it on breast reconstructions. We use it on the Brazilian butt lift. We use it on the lips. We use it to fill divots if it was taken out too much. So what we are doing that, and probably the reason that half or more of that stays, is because of the fact that it's a very rich source of stem cells. And the stem cells are pluripotential, and they keep on dividing.
Dr. Cucin, you already mentioned, but exists criminal plastic surgery?
Well, fortunately, I don't see very much of it because I don't see, I haven't seen any patients either in New York or here who were the victims of it. I read about it in the paper like you do. And what I would urge patients to kind of avoid that, aside from obviously not having somebody put in some pump oil in their butt in somebody's garage, you should check, ask your surgeon where he trained, where she trained, if he's board certified, if she's board certified, if they're a member of ASPS, American Society of Plastic Surgeons, which is the big one that most of us belong to. A couple of obvious questions like that to make sure that you have a real doctor or a doctor who's trained to do what you want. And don't be afraid to ask the doctor, hey, how many of these have you done before? Is this your first nose job? Have you done? Those are very common, be an intelligent consumer, and then you'll avoid being the statistic we read about in the newspaper.
Dr. Cucin, do plastic surgeons use robots for extremely precise work in plastic surgery?
At this point, no, not at all. One of the problems with robots is feedback. And the best you get out of the best Da Vinci these days is haptic feedback. That basically means like as you're using your phone, you get the click and a little bit of a thud. That's a far cry from the delicate feel that a surgeon uses when he's doing a facelift. So the bottom line is, I don't think we're going to see robots in plastic surgery for a long time. Maybe we will eventually, but the robots will have to be more advanced, that you have feedback that's more meaningful than just the haptic feedback we get today. I think the doctor's hand at this point is pretty critical. The advantage of a robot is it essentially gears down your motion. That you can have to move 10 times as far to get as far. That's a great kind of precision. But if you lose the feedback, that's a trade-off that at this point is not a good trade-off.
Dr. Cucin, how will look like plastic surgery in the future, and what to expect for both doctors and patients in this field of medicine?
Well, video consultations have kind of taken off during the COVID era. And what we had before that, of course, we had, computer imaging. Well, it's obvious that they're just going to merge. So as part of that video consultation, the doctor will just show the patient a screen of, well, this is what you're going to look like with a size, C cup. This is what, excuse me. This is what this is what it will look like. We can reasonably expect your nose to look like, if we sculpt it. This is a reasonable effect the way your waist will be more narrowed after a liposuction. As with any tool, that's a tool that can be misused. But with an honest doctor and good equipment, it can help reasonable expectations. And there's no reason now that can't be taken forward to the point of the consultation, as opposed to waiting until kind of one-on-one in a physical meeting.
Dr. Cucin, thank you so much for being with us today.
My pleasure, Alex. My pleasure.